the tear of the middle meniscus, and as you can see, it is a bucket-handle tear, and this medial fragment is lying loose inside the joint, and due to its entrapment between the medial femoral and the medial tibial condyle, it is causing loss of range of motion, locking, and pain to the patient. Friends, this is the avulsed and torn anterior cruciate ligament lying loose inside the joint, and as you can appreciate, it is detached from its femoral attachment. Friends, this is the place on the lateral femoral condyle where the anterior cruciate ligament should have been attached. I am shaving off the remnants of the anterior cruciate ligament in order to make space for the graft. This is the posterior cruciate ligament, which is intact. Just shaving off the remnants of the anterior cruciate ligament. I am cauterizing all these bleeders with this electrocautery in order to prevent any bleeding. The attachment point of ACL in order to make it rough and promote good healing of our graft. This is the femoral jig of our ACL reconstruction system, trying to keep it horizontal, posterior, and around 10 o'clock position. Friends, this is an Arthroscopic system. Now I am drilling my femoral tunnel through this drill guide. Of this femoral tunnel is around 30 mm. Friends, this femoral tunnel is being made through an anterior-medial portal in order to keep our femoral tunnel a bit horizontal, so in order to prevent pivoting of the knee in future. Drilling my femoral tunnel with a reamer of around 8 mm and drilling up to a depth of around 25 mm and keeping precaution not to perforate the outer pockets. The bond is being shuttled through the femoral tunnel with the help of the guide wire. All the debris generated during the drilling of the femoral tunnel is being removed with the help of shaver. As you can see, there is good bone stock all around the femoral tunnel. Here I am cleaning all the soft tissue that are coming in my way with the help of shaver in order to give clear space for our tibial zig. Friends, this is the anterior horn of the lateral meniscus. Just probing it and keeping our tibial zig just 2 to 3 mm posterior and medial to the anterior horn of the lateral meniscus. Friends, our guide wire has come just posterior and medial to anterior horn of lateral meniscus, and it is just flush with the anterior fibers of the posterior cruciate ligament. And as you can appreciate, there is no impingement of the guide wire with the femoral notch. To check out whether there is an impingement of the guide wire with the femoral notch or not. Widening our tibial tunnel with the help of an 8 mm drill. Cleaning the edges of the tibial tunnel with the help of the shaver in order to prevent smooth passing of our graft and in order to prevent any impingement. Now the endobutton graft construct is being passed through the tibial tunnel into the femoral tunnel. Endobutton is going inside the femoral tunnel and it will be followed by our graft. left, and the graft is being inserted up to a depth of around 25 mm. Now the knee is being extended and it's being checked if there is any impingement of the graft with the femoral notch. As you can appreciate, there is no impingement of the graft with the femoral notch. After cycling of the knee, the graft has been fixed on the table side with the help of an interference screw.